The most common disorder that causes poor sleep is obstructive sleep apnea. Apnea means absence of breath. So absence of breath for 10 seconds or more than 10 seconds is called the sleep apnea. There are the three common type of the sleep apnea: obstructive sleep apnea, central sleep apnea, and mixed sleep apnea. Sleep apnea is diagnosed in the sleep laboratory. The name of test is called polysomnography. It is measured by the apnea hypopnea index. If the index is more than 5, the test is mild sleep apnea. So in the mild sleep apnea, there are 5 to 15 times no breath in hour, and in moderate sleep apnea, from 15 to 30 times no breath in hour, and in severe sleep apnea, so more than 30 times breathe stop for more than 10 seconds. A risk factor for the sleep apnea are the obesity, upper airway abnormality, hypothyroidism, alcohol and sedative use, nasal congestion, DNAs, polyp, deviated nasal septum, or enlarged tonsils. Common symptoms of the sleep apnea are daytime sleep, or say excessive daytime sleepiness, gasping, choking, loud snoring, morning headache, feeling fatigued, tired all the day, feeling sleepy during driving, increased blood pressure, irritability, insomnia, difficulty in paying attention, in movement of the leg during sleep. These are the common symptoms and signs of the sleep apnea. 1 out of the 4 adults have this problem, and 80% people are unaware, and they are not diagnosed, they are not treating the sleep apnea. If sleep apnea is not treated, what are the consequences? Increased blood pressure, heart attack, cardiac diseases, diabetes, depression, stroke. These are the complications of untreated sleep apnea. Sleep apnea is tested in the sleep lab, and test is called the polysomnography. Management of the sleep apnea is cpap, continuous positive airway pressure, reduce weight, reduce alcohol consumption. CPAP is the gold standard treatment for the sleep apnea. It reduces the risk of cardiovascular diseases and reduce the blood pressure and other complications